Community South Bay, where we provide free social and emotional support to cancer patients and their loved ones. Tonight, we have a program that's being presented by the South Bay Survivorship Consortium, and this is a collaboration of healthcare providers and other non-for-profit community-based organizations where we all work together to provide education for cancer survivors. Today's program focuses on how psychedelic ketamine therapy can support mental health recovery for cancer survivors. So just to let you know, we are going to have the microphones muted, and we'd like you to use the chat function if you have questions that you would like to ask. So you can put any of the questions in the chat and we'll answer those at the end. And the other thing is that we will have an evaluation at the very end of this program, and that will pop up automatically. And then we plan to have one more workshop this year, probably around November, but we'll keep you in the loop when that topic and workshop comes out. And so without further ado, I wanted to introduce our speaker tonight, Dr. T.J. Rai. He is a holistic psychiatrist and psychedelic ketamine therapist here in the South Bay. He is board certified to treat children, teens, and adults. And for over 25 years, Dr. Rai has used a holistic treatment approach to emotional wellness, which includes lifestyle changes, psychotherapy, and medication management. He has a website at holisticcpsychiatryla.com, which I'll share in the chat box. But please help me welcome Dr. Rai. Thank you for being here.
Thank you for the introduction. Hello, everyone. Hope you can hear me well. If not, I think there's someone helping with technical stuff behind the scenes.
We can hear you just fine.
Right. So let me share my screen so that everyone can follow along as I talk. Once I maximize the screen, I won't be able to see the chat window, but we'll be taking questions at the end. So, all right. Can everyone see what's on the screen?
Yes, it's showing up, and just you can play. Yeah.
There we go. Okay, so so today's talk is really about the role of psychedelic ketamine therapy in cancer survivor treatment plan. And so, sorry, I'm having trouble navigating to the next screen. There we go. So I wanted to start with what is ketamine. There's a lot of perceptions, misperceptions, yada, yada, yada about ketamine. I've had people say, why would you give someone a horse tranquilizer? Ketamine also has a reputation as a party drug, a special K. There are people that are concerned it's a date rape drug. It's also been implicated in Matthew Perry's death. And nowadays people are like, is that what made Elon Musk crazy? And then there's also the highs that people talk about with ketamine, where they may know someone who was severely depressed and it really helped turn that person around. And people are also reading about this psychedelic renaissance of how psychedelic therapy, including with ketamine, can help overcome PTSD when therapy alone doesn't work. And cancer, surviving cancer is really surviving a major traumatic event. So that's what's the parallel between PTSD or post-traumatic stress disorder from other causes and having had cancer. So I hope that by the end of the talk, you will be able to overcome any sort of misconceptions and also come back with your questions at the end. So what is ketamine? Ketamine is a general anesthetic that is dissociative. And so what that means is that it will disconnect us from even our physical bodies and from perceiving our bodies the way we normally perceive them. If anyone's been to a dentist and remembers the numbing sensation that happens in the gums, that's similar to what happens with ketamine, except it happens for the entire body. And at a high enough dose, it is an anesthetic, and that was the first use for which ketamine was developed. It is considered safe, even in infants, so people who are a year older or less. Um, and the anesthetic dose is significantly higher than the dose we use for psychiatric treatment. So in children, it's considered one of the safest anesthetic. So when people say horse tranquilizer and why would you give it to someone? Yes, you can use it to tranquilize horses and you can use it to anesthetize humans. And in hospitals across the country, ketamine is used a lot for anesthesia. It's been around since 1962, and it has been used as an antidepressant for 25 years now. The first research study started in 2000. And then there's one type of ketamine that was approved by the FDA for treatment of depression in 2019. And the talk will be recorded, and if anyone wants the links, I will send them later. But that's the interesting thing about ketamine is that it is also present in nature, and there is one type of fungus that actually produces ketamine. So there were already a couple of questions that came in by email when the talk was advertised. So I will start off with answering those first, which is who can benefit from ketamine therapy. The first use approved by the FDA in 2019 was for treatment-resistant depression, which is depression that has not responded to standard treatment with at least two different antidepressants. The next use that was approved by the FDA in 2020 was for people who are having suicidal thoughts in the context of major depression. That's because ketamine can reverse suicidality so fast that it can even prevent a hospitalization. And the third use, which was just approved this year, was for major depression when people have not tried other types of antidepressants because it is very effective, very fast. And the thought was we don't want to have people fail multiple treatments before they get something that is effective. There are also some other off-label uses that you can read on the slide for PTSD, OCD, anxiety disorders. It's being studied for a lot of different conditions. And because I also treat teens, I have treated teens with ketamine therapy as well when they haven't responded to standard treatments. So this was the other question that came in. Who should not get ketamine therapy? So if someone has ever had psychotic symptoms, either a primary psychotic illness like schizophrenia or psychosis due to a mood disorder, whether it's major depression or bipolar disorder, that is a contraindication for ketamine. If anyone has increased intracranial pressure, if anyone's pregnant currently, or has uncontrolled hypertension. So this is because ketamine can raise blood pressure, which actually makes, as an anesthetic, makes ketamine very safe because if someone's getting surgery and there's blood loss, it will raise the blood pressure. But um, in clinical settings for treating depression, elevated blood pressure is a side effect. So uncontrolled hypertension is a problem. I have successfully treated lots of people that have well-controlled blood pressure. And then that doesn't present a problem as long as the blood pressure is normal before we start the treatment. Acute or unstable cardiovascular disease. So one of the effects of ketamine on the heart is that it increases heart rate, just like it increases blood pressure. So if someone's had a recent heart attack, then their heart isn't stable enough to handle the increased cardiac demands on the heart. In general, if someone can run around a block without getting chest pain, the fact that they've had previous heart disease does not prevent them from getting this treatment. And like all medications, if there's an allergy to ketamine, or we know they have not done well with ketamine in the past, then they're not a good candidate. Actively using substances of any kind, prescription or non-prescription substances, is a contraindication as well. With the caveat that there are studies published and also ongoing studies on treating substance use disorders with ketamine, which I'm not going to focus on that today, but suffice it to say that a lot of these substances, either the use of the substances or recovering from them, can create mood problems. And so we don't want to be treating something with ketamine that requires treating it in some other way. So where does ketamine therapy fit in for cancer survivors, and why use it? The biggest reason is that the effect of ketamine as an antidepressant is within hours, as compared to it can take several weeks with a conventional antidepressant. The other reason is that psychedelic therapy can help the brain form new connections, which can really help you reinvent or look at your life and yourself in different ways and have a different experience. Um, and because psychedelic experiences can also lead to what's called mind expansion or consciousness expansion, it can lead to reduced existential distress, especially when that's combined with psychotherapy. Um, Pain management is an important use of ketamine therapy. I won't be focusing on that part of in today's talk, because that's not my sort of forte. But it is definitely used a lot in pain management and can help reduce the amount of opiates someone's on. And so depression, the rates vary widely in different studies, and they also vary between whether the studies are done in the US or in Europe, and also whether it's males versus females. But it is very common for people to be diagnosed with depression when they're undergoing cancer treatment. And suicidality, which can lead to hospitalization, is a really, really important thing to address, and that's what ketamine can reverse basically overnight or within hours. So I put some statistics on there just for people, and when I first read them, I'm like, really? Like, that's how many people die from suicide? It's heartbreaking because it's a preventable cause of death. Um, so The biggest difference between ketamine and other antidepressants, as I mentioned, was that it's fast acting and people feel relief within hours. Other antidepressants take up to 6 weeks for the full effects, which also applies to suicidality. And the other usefulness about ketamine is it can work when routine medicines haven't helped or haven't helped enough. The downsides to ketamine is it is meant to be administered at the doctor's office, so you can't generally take it at home, especially at a psychedelic dose, and we'll talk about what that means. It is time consuming because of the amount of time that has to be spent in the doctor's office. And with ketamine, we can provide people with a psychedelic experience, whereas other antidepressants don't have a psychedelic effect. And at the neurochemical level in the brain, the other difference from ketamine and the other antidepressants is the receptor that it works on is different. Um, and that also explains why it can be effective when conventional antidepressants haven't helped. So this is a little cartoon. I won't spend too much time on this. It's very technical, but it explains what the difference is between ketamine and the other antidepressants. Um, so here's another useful slide to understand what the different types of ketamine are that are available. I had mentioned earlier that the FDA approved version is called S-ketamine, and this slide explains that. The naturally occurring form of ketamine is a mixture of two different kinds of three-dimensional molecular structures, kind of like the mirror images that our two hands are of each other. And so the ketamine that's used for anesthesia is racemic. It contains equal mixture of both molecules. And the FDA approved version is one of these rotations. And that's because in order to patent a molecule, for a drug company to do the studies that it requires to get FDA approval, is usually about $1 billion to bring a drug to the market. So then drug companies like to patent them so that they have exclusive rights to sell that to recoup that cost. So the generic ketamine is off-label and it is a fraction of the cost of the FDA approved version. And the FDA approved version, the other reason for them to develop it was because the psychedelic experience with ketamine was considered a quote unquote side effect. But those of us that are involved in the psychedelic therapy field actually think that if someone is going to get ketamine, and we can give them a psychedelic experience, then that's sort of hitting two birds with the same stone, because that would be added to the antidepressant effect and doesn't take away from the antidepressant effect. In fact, it would enhance it because it can help with exploration of consciousness beyond what the antidepressant effect alone does. There are different routes through which the generic ketamine can be administered in the vein, in the muscle, so that's IV or IM, or intraoral, which is absorbed from the mouth. It can be given intranasally as well as a spray or rectally. And the FDA-approved version is only administered as a nasal spray. They're both administered at the doctor's office. And both these experiences, the FDA-approved version as well as the generic, is about a 2-hour process, at least. So this again is a little different representation of the ketamine molecule. So I like to teach through stories. So I can say that my first case that I treated with ketamine, I call her Jane Hero rather than Jane Doe. I think of this patient as my hero because, and I'll explain why in a minute. This was someone who was not my patient. Her primary psychiatrist had referred her to me for treatment with S-ketamine with Spravato, the FDA-approved version, in the summer of 2020, once things reopened after the pandemic. And she was severely depressed, and there were days when she would not even get out of bed. And during her very first session with ketamine, she was just happy. And like when I went in, so my assistant was with her during the process, as is required with all people that do the Spravato, the FDA-approved version. People need monitoring for their blood pressure before and after, and they need to be monitored during the session. So I was passing by the door and I just heard her laughing. And at the end of the session, I went in and she looked like a completely different person. And for me, as a psychiatrist, it was so gratifying to be able to visibly see someone change within the span of 2 hours. And so after her first session, she went home, and later that day, she left me a message that she went out to work in her garden in her backyard for the first time in years, and even asked her husband if they could go out to dinner. Huge change from the depressed person who couldn't get out of bed, and sometimes her husband would want to could take her out to dinner and she wouldn't want to go. So really, this blew my mind that this patient's world went from this like dull and drab to like, full technicolor. And and I was for the first time convinced of what a useful treatment this was. So based on her experience and, I mean, she continued with her ketamine sessions for a while, and she had sustained improvement with that. Um, the and then for a while we did maintenance sessions, once every 3 months. She did continue with the medications that her primary psychiatrist was prescribing, and they had not been enough for her to get into remission, for the depression to be fully gone. But once she was able to get there with the help of the ketamine sessions, then the other antidepressants were able to help maintain her, because she had struggled with depression for many, many years, I think over a decade. And so her maintenance regimen was once every 3 months for about a year. And she did really well. At one point, she needed a reintroduction, but so since then, she's been maintained on her routine antidepressants. So I had mentioned earlier that there's a difference between using ketamine at the antidepressant dose versus the psychedelic dose. So some of the difference is in the type of ketamine. So the FDA approved version is less likely to be psychedelic. And part of that reason is that it is limited to an 84 milligram maximum of the S-ketamine that can be given to any patient, because that's the maximum dose that was studied to get FDA approval in the research studies. Well, for anesthesia, we know ketamine is safe in up to 2 to 3 milligrams per kilogram. So the psychedelic dose for ketamine is higher than the antidepressant dose. And antidepressant dose is also called the psycholytic dose, lytic as in to kill the depression, basically. Um, So psychedelic is derived from the Greek words psyche, which means soul or mind, and then to manifest. So psychedelic means consciousness, raising consciousness, or mind manifesting literally, but it's really about manifesting consciousness. And so this is the image that I can say faithfully represents what some people have told me their experience has been like. It's really this sort of mind expansion, and it can be very visual. Unlike some other psychedelics, ketamine isn't always this visual. Um, for some people, the psychedelic experience can be more like awake dreaming, but this is more of how my mind got blown by how rapidly ketamine works for people, and also some of the insights that people have received through their psychedelic ketamine journeys. And so, what is, when we say psychedelic, what does that feel like? So psychedelic experiences are thought to heal because they activate the body's inner healing intelligence. And so the way of understanding that is that if we have a cut accidentally on a finger, we don't have to tell that cut how to heal. The body knows how to heal itself. With the emotional wounds that we sustain, sometimes the body doesn't quite know how to heal itself. And sometimes the work in therapy, which can be focusing on the positive, looking at all the things that are still working in life, sometimes that becomes really difficult to do when we're weighed down by depression, or, having survived trauma. And surviving cancer is surviving major life-threatening trauma. So the way that the inner healing intelligence is thought to be activated by psychedelics is by disrupting the default mode network of the brain, we all have a certain way of perceiving ourselves and the world, and that's called the default mode network. And disrupting that, disrupting our usual way of thinking, can lead to the ability to form new connections in the brain. That's called neuroplasticity, the ability to form new connections that leads to developing fresh perspectives. The other part of what helps ketamine work so rapidly and so well as an antidepressant is honestly, it is a high. It's a controlled high, but in psychedelic terms, it's called a peak experience. And so that is part of when the reason why I had used that case example earlier of the patient that had been so depressed for so long that she couldn't get out of bed, and all of a sudden she was elated, is that depression can lead us to forget who we were, forget how to feel happy. It's like we're at the bottom, at the pits of the despair that depression can cause. And an experience such as the one she had with ketamine therapy can serve as a catapult or like a trampoline to like shoot you up to the top of the mountain. It's called a peak experience for a reason, because once we've experienced what the view from the top of the mountain is like, then it can become easier to do the work that we need to do to climb our way out of the hole of depression all the way back to the life that we want to live. So that's a summation of my understanding and the best way I can explain how psychedelic therapy works and what it does in the body. So our process for psychedelic therapy with ketamine combines both the antidepressant or the neurochemical effect of the ketamine with the transformation that psychotherapy can cause. Um, and so for this, the set and setting are very critical. So set refers to the mindset. And so in general, that means that if I tell someone, don't think of a pink elephant, the first thing people are going to think of is a pink elephant. So when we're setting an intention and the mindset before the journey, my invitation to people is, instead of saying, I want to feel less depressed, I want them to come up with what could be the opposite of that. And often people say, I want to connect with joy. I want to feel happier, or some version of that. So what we set out in the world and what the mindset that we go into the experience with is likely to be enhanced by a psychedelic experience. And setting in psychedelic setting refers to where you do them. And this is why it's done in a controlled environment in the office rather than at home or recreationally with friends or so on and so forth. So this is the best example I could think of what would not be the right setting, is that if someone has paranoia and they're going to a clinic to get therapy, and there's this sign that says, please be seated, they'll be right out to get you. So we do our best to have a very calm and controlled setting where people can feel they can really surrender to the experience and invite something different for themselves. And so we're going to do a little show and tell where we're going to show you the room where we do the ketamine therapy, and also show you what a little bit sample of what the process looks like. So it's a three-step process. The first step of the process is for me to meet with the person that's interested in ketamine therapy, get their full psychiatric history, and make sure they are both medically and psychologically appropriate for the ketamine therapy. That usually takes 1 or 2 visits. And also, I want people to have enough trust in me and in the process and get all their questions answered. People often bring a family member with them. family members have questions. And also family members are involved in the treatments because we do not allow people to drive back home after a session because they might still be a little bit in an altered space and dizzy. And so generally we prefer to have people get a ride here and get a ride to and from the office. If not with a family member, then with a trusted friend. So the first step is the intake and prep sessions. And then the bulk of it is the psychedelic sessions. The first psychedelic session that people do is a breathwork session. And that's because using your breath effectively alone can lead to a psychedelic experience or what's called a non-ordinary state of consciousness. The advantage of doing it this way is that people know both how to use their breath effectively to calm their anxiety down, and breath alone can be psychedelic, so it can enhance their psychedelic experience. And moreover, people get familiar with the room and with the kind of music that we use during the psychedelic ketamine therapy sessions. And also because people get familiar with the facilitator I have that works in the office, who's a trained breathwork facilitator, and he stays with people during the entire ketamine journey. So just like people get familiar with me during their psychological intake process, I want people to get familiar with the breathwork facilitator and also learn how to use their breath appropriately. So the ketamine experience itself lasts about um, an hour and a half. And at the end of the hour and a half, I come back into the room and we do psychotherapy at the end to find meaning in what came up during the ketamine journey. And so once the ketamine sessions, whether it's 6 or 8 sessions that someone does, after that, long-term therapy can still continue. So what I'd like to do now is I'm going to take a pause to show you guys the ketamine therapy room. And also we'll do a little demo of the breath work that we use for helping people navigate the space. I want to, just so everyone doesn't get motion sickness, I'm going to turn off my camera briefly.
Sounds good.
Hi, everyone. Just a moment. I'm Hiram. I'm the breathwork facilitator at Dr. Rai's office. Just going to show off the room a little bit. The walls are bare on purpose. We do have a little desk that just holds all our equipment, and then a little seat for me for when we get started. And I was trained in pranayama from India through the Native American Church in 2009, where I assisted different ceremonies up until fairly recently. And today, if you'd like, you can follow us through a simple technique to get into deep connected breathing. So if you would like to join us, get into a comfortable position and put one hand on your belly and one hand on your chest. All right, so we're gonna breathe slowly into the belly first, inhaling and letting the belly rise, then the middle of the chest, and finally the upper chest. And exhaling nice and slowly, letting all 3 parts fall, and pushing the belly in as you exhale. One more time, a little slower. Inhale from the belly, the middle of the chest, and the upper chest, and back down nice and slowly. Let's do a 4-second inhale and a 6-second exhale. Exhale completely to begin. Hold at the bottom and inhale 2, 3, 4. Exhale 2, 3, 4, 5, 6. Let's do another 2 rounds. Inhale 2, 3, 4. Exhale 2, 3, 4, 5, 6. Inhale 2, 3, 4. Exhale 2, 3, 4, 5, 6. Let's extend that. Let's go a little bit longer. Let's do a 6-second inhale and an 8-second exhale. Exhale completely to begin. And inhale 2, 3, 4, 5, 6. Exhale 2, 3, 4, 5, 6, 7, 8. Inhale 2, 3, 4, 5, 6. Exhale 2, 3, 4, 5, 6, 7, 8. Inhale 2, 3, 4, 5, 6. Exhale 2, 3, 4, 5, 6, 7, 8. Relax. Take some time to just notice how you feel. How do you feel, TJ?
So, I don't know if I can go on with the rest of the talk now. I'm so relaxed. But I'm gonna share the screen again so we can continue with the talk. And let me press play here. All right. So, hopefully everyone can see the slides again.
Yes, the slide
And
wrap.
so the process for people to get connected with their breath is actually very simple. It's not very fancy at all, and it does require some practice. And I feel so relaxed with just that little bit of breathing that I did. That was what I think a minute or two. And can you imagine how relaxing that can be if someone breathes like that for a whole hour? So, that's a little bit of what this process looks like for people. I have another example that I wanted to share for someone that had major childhood trauma that was referred to me. And this was a patient that had been on fluoxetine, also known as Prozac, for many years, and didn't technically have treatment-resistant depression, but she was still carrying a lot of anger and resentment at what had happened in the past with her parents, and was referred by her therapist because she was kind of stuck in therapy and not able to move forward in the way that she needed to and wanted to. And it was interesting that in her very first session, she actually went back in time and experienced herself as being 10 years old and experienced being in that childhood home that she grew up in before her parents split up. So that was before that, everything in her life had been, you know, pretty typical for someone her age. But at that age, her father left her mom, and after that, her life was forever different. And she was still carrying a lot of the anger and resentment of what happened. And for her to go back to that same childhood home and remember the pattern on her bedspread, and she was just, for the first time in her adult life, looking at her childhood home with fondness and as a fond memory, and not just a place where she had trauma. In her second session, she went back in time to when she was a teenager and in her grandfather's study, and she was able to consciously keep in mind that her grandfather had become a father figure for her, um, even though her own biological father had left the country. And so over the subsequent sessions, she really worked through letting go a lot of the anger and resentment of the past and being able to see her parents as human beings in their failings and their strengths. And her therapist was even amazed at the amount of shifts that she made in just 8 sessions of ketamine therapy, which she hadn't been able to do previously in years of therapy alone. So this is an example of how ketamine can help with overcoming past trauma. I was invited to do this talk by a doctor that I've known for many, many years. And full disclosure, I have not personally had the experience of working with a person who has survived cancer as a trauma. And I have worked with many patients that have survived other different kinds of trauma. So I thought I would include this as an anecdote because I myself learn best through stories. And I think we have about 15 minutes for questions. There's more I could talk about, but I'm going to essentially at this point. So this is, you guys met Hiram before. Goldie in this picture, she's my office assistant, and she's also trained as a psychedelic facilitator to stay with people during ketamine sessions. And together we hope to help you feel emotionally well. So with that, I will end the presentation and take questions.
Thank you so much, Dr. Rai. We do have some questions that are in the chat box. So the first one is asking,
Wait,
can someone with past
did it log
substance
me out?
abuse, can they use ketamine?
No, okay. Sorry, the Zoom window disappeared and I was like, did it log me out for some reason?
Oh, no. Did you hear the question?
Nancy, you're muted, I think. I can't hear you. Or am I muted?
You're,
Yeah, okay, we're good.
okay. Can you hear me okay?
Yes.
Okay, so the first question in the chat, somebody's asking, can someone with past substance abuse, can they use ketamine?
Yes, 100%. I just don't like people coming drunk or high to a session because at that point we would do breath work, we wouldn't do ketamine.
Okay.
In fact, I've successfully treated someone with cocaine use disorder who really benefited from ketamine sessions. So as I had mentioned before, it is used in research studies to treat substance use disorders, but that's case by case basis.
Okay. The next question is asking about how many sessions are needed to treat major depression?
It takes, for the most part, it takes at least 6, and that's been borne out in multiple research studies that have been done over the years. So in other words, it's not considered a sustained improvement until people have at least 6 sessions. If people haven't responded by the third session, they're a non-responder. So usually people respond by the first session, but sometimes, it can take people some time to actually allow the medicine to do its work. And what I mean by that is normally the human body is designed to feel itself. So when people start to disconnect from their bodies, I've had people sometimes say, well, am I dying? Like, I can't feel myself, but how can I be dying? Because I can hear myself talk and I can hear music in the room. And that's part of the reason why we always have someone in the room and don't send people home with ketamine. It can be very disorienting to not feel your body and become pure consciousness. And because of that, sometimes it's the second or the third session before people will actually allow the medicine to do its work. And the dissociation is required even for the antidepressant effect, not just for the psychedelic effect. That dissociation has been consistently shown in research studies to be a required parameter of there's enough ketamine occupying enough receptors in the brain for it to do its work. So minimum three to see if people are going to respond or not. And people have an improvement right away, but then it tends to wane after 2 or 3 days. So think of it as like if someone's here and then ketamine helps them get up to here, then the second session can be here. So the idea is to there be less drop in the mood in between sessions enough to where it can become self-sustaining.
Okay. This next person had put a question that seems almost like a follow-up. It's saying, do you recommend 6 sessions only? What happens after that? And what dose do you use?
So sessions are very fluid in my office. I don't, a lot of the ketamine therapy that's done in the community is very different from what we do. A lot of the ketamine clinics in the community are run by anesthesiologists who don't have a lot of experience treating major depression. And what I've been told by people that have been to other clinics is that they'll often pay for 6 sessions up front, whether they use them or not. At my office, we only bill one session at a time. I tell people what my recommendation is, which is if we're treating treatment-resistant depression that hasn't responded to other things, it is good to come twice a week for at least 3 weeks. At the end of that, we can reduce it to once a week. We can go to every other week. And because I meet with people every time, and because I've been in mental health for over 25 years, it's a give and take. It's a dialogue between me and the patient of like, are you feeling enough sustained improvement in between sessions to be able to not do the sessions anymore? Um, so most often what happens is people come twice a week for 2 weeks, sometimes 3 weeks. Then we go to once a week, and that goes on for a couple of weeks. Then we go to once a month. Sometimes then we go to every 3 months. And when I was using the FDA approved version, the Spravato, I was following the same protocol. And so it's important to not abruptly stop the ketamine therapy sessions. So the best analogy I can give is if the battery on a car is dead and we jump start it, we need to keep it running for a while before it can become self-sustaining. The same applies to the battery of the motor of the brain. We can get ketamine therapy to like get people better, but in order to sustain it, um, usually requires more careful consideration than like 6 sessions and bust. I mean, that's a good way to have people keep coming back for another 6 sessions, but I'd rather like, it's six of one, half dozen of the other sometimes, but my goal is always to get people better. And I always joke with people that being a therapist is like being a parent. You raise your kids and you hope they only come back if they're in crisis, but otherwise
Mm.
they're out there living their lives.
Gotcha. Okay. Well, I've got a couple people here asking, is it covered under insurance?
So I knew this question would come up. My office doesn't bill insurance, and there are various reasons for it. The cost of Spravato, the FDA approved version, can be covered by insurance, even though it's $1,000 per treatment. The generic ketamine is usually not covered by insurance for psychiatric use, but it's pennies on the dollar. It's very, very cheap. Um, and the insurance usually does not cover the monitoring. So even though the FDA approved version also requires being monitored in the office, I think insurance maybe pays for $25 for the 2 hours or some crazy low amount, but you can't get a competent person to stay with someone for that long. So yeah, so I don't know. Hopefully that answers that question.
Is your office available to help a patient sort out what they could sort of predict the payment might be based on insurance that are cost covered and not covered?
Yes, so that's my assistant can help with that. Goldie can help people figure that out.
Okay, great, great. So there's a few more questions here. And you may have mentioned this earlier in your presentation, but are there any conditions or disorders that are contraindicated for ketamine therapy? Could you remind us of those?
Right, so psychosis is the biggest one, and then active substance use disorder, active pregnancy, active heart disease that's unstable, and uncontrolled hypertension. Like those are the biggest ones that are contraindicated for ketamine therapy.
Okay. We have someone asking here that they see on your website that Hiram offers some breathwork classes. Can you please let us know what some of your group offerings are? And it looks like Hiram put in the chat box a link to the Eventbrite. But did you want to say anything more, or does that suffice?
I
Yes. Sorry. For now, it's just this Saturday. But keep in touch or keep checking back up on the website because new ones are coming up soon. So they're mostly done on Fridays and Saturdays, and Saturdays are in the morning, so from 11:30 to 1. So if you are trying to fast, that's a good way to at least get a 16-hour fast in pretty easily. And then the ones on Fridays are in the evenings, so there's an opportunity to do both. But yes, keep your eye out, and they're donation based. So if you've ever wanted to try a breathwork session and aren't too sure, this is a nice, safe way to do it inside the beautiful office that we're in.
Mm.
So yeah, come on
Perfect.
down, check us out.
Thanks, Hiram. This next question is asking, have you ever had a session or experience where the patient freaks out, gets too overwhelmed by their journey experience? If so, how do you manage that scenario?
Right, so ketamine, because so I had mentioned earlier what the freak out is, which is feeling disconnected from the body. And for that, that's part of the reason why we never do a medicine session without people doing a breathwork session with Hiram first. Because people need to be comfortable with being able to slow down their breathing when they start to feel anxious. If people don't learn that, then it's more tricky when they're disconnected from their body because of the neurochemical effect of the ketamine to then get the hang of it. But because they've practiced it, we've not had anyone that actually had a really difficult time navigating that part of the journey. The other things so there are other psychedelics that are used for psychedelic therapy and are legal in other states, but not in California. Some of the other psychedelics are very activating and can lead to both visual phenomena and also more of a being dropped in past trauma. That hasn't happened with ketamine in my experience. And that's because neurochemically, ketamine is different than the others. Ketamine is like a soft reboot for the brain. It's not sending the brain into overdrive like some of the other stuff does. So the anxiety that comes up often has to do with the difficulty surrendering, which happens in cases of both medical trauma, as in cancer survivors, for instance, or other like surgical types of medical trauma, as well as when people have had emotional, physical, or sexual trauma in the past. Oh, you're muted, Nancy.
Thank you. Thanks for pointing that out. This next question is saying, what route do you use and dosage? And that might be a repeat question, but route do you use and dosage?
Right. So for the ketamine therapy that we do in the office, we predominantly use either intramuscular, which is injection in the muscle, or we use intraoral lozenges that dissolve in your mouth, like dissolving candy. And the only tricky part of that is that the medicine needs to be held in the mouth and swished around like that, like gargling with mouthwash. but without swallowing. So that takes about 15 minutes for it to be absorbed. Some people don't like injections and prefer that. And then it also feels like they're slowly falling asleep. And some people feel less anxious with that form of getting disconnected from their bodies because they can feel the numbness in the mouth and then the tingling in the fingertips, and then it progresses to the whole body. Those are the two predominantly that we use. I haven't been using that much of the Spravato that's FDA approved, which is intranasal, because I'm limited to only using one dose, and I like to individualize the dose for people.
I don't see any other questions, but I do see a lot of individuals saying, thank you so much. It's been very helpful, very informative. Someone saying breath work is amazing. Wonderful. So thank you for taking, both of you, Hiram and Dr. Rai, taking the time out to help us better understand what all is involved in ketamine therapy and to think about it as a solution for treatment-resistant depression for cancer patients.
Yes.
I wanted to also just encourage everybody to stay on to, I believe there's a survey that is going to be coming out. It's in the link. It says, thank you for joining us. Please fill out the quick survey by clicking the link below. So you'll see it in the chat box. If everybody could just click on that, we'd be so appreciative. I do see someone asking a question about microdosing psilocybin, but Dr. Rai, I think that's a little off topic, but if you'd like to address it, you can.
Well, I'll mention it. So I did put my the office address, email address. Anyone interested in doing breathwork or workshops, please get on the mailing list, and you can email either the office or you can email Hiram at cosmicbreathwork.com. So if you can just write down those addresses, I think the chat disappears when the Zoom ends. So microdosing, I think the use of microdosing for psychiatric conditions has outstripped the scientific literature on it. The scientific studies that have been done with psilocybin have all involved macro or bigger doses for treatment of post-traumatic stress disorder and severe depression. And as of now, psilocybin is legal in the state of Oregon and also in Denver, Colorado. And microdosing, what I know about the science behind how mushrooms work and what microdosing does lead to rapid development of resistance to the particular dose that's used. So it's tricky, and because once I say it, then it becomes like whatever accepted scientific knowledge, because I'm a doctor, the best I can say is we don't know enough about how much is too little, how much is too much, but we do know the body develops resistance to it really fast.
Okay, great. Thank you for answering that last question there. Thank you again. I really appreciate you sharing your knowledge and helping us to have a better understanding. So I'm going to wish you all good night, but we are going to stay on to allow others to complete the survey. So we'll stay on just for a few more minutes. But again, Dr. Ryan and Hiram, have a wonderful evening.
Thank you.
And for those of you who have completed the survey, you're free to have a wonderful evening and leave the Zoom. But for those who are still completing, we'll stay on. Those are really helpful to get the feedback from the surveys. And it helps us plan for what to bring to you guys next.
How do I get the survey? I'm sorry.
In the chat box,
Oh, okay.
there's a
Got
link.
it. Okay. Oh,
Okay,
yeah. Okay. I see it. Okay. Thank you.
perfect.